Welcome to the Deep Dive. We're here to cut through the noise and give you the essential insights on topics that matter. And today, we're really diving deep into something critical, something that affects all of us every day, even if we don't always see it. We're talking about commercial driving. The trucks bringing goods, the buses moving people. It's the lifeblood of our economy, really. But driving those huge vehicles, well, it comes with massive responsibility. And right now, in 2025, that responsibility is under let's say, an intense spotlight. Our focus today, driver safety, specifically the government's really stringent approach through the DOT drug and alcohol testing for CDL holders. We've sifted through the regulations, the official guidelines, and we're going to break it down, make it clear, make it impactful for you. Let's get started. So to really get why these rules are so incredibly strict, you have to think beyond just, regular traffic tickets. This is a different league. Picture a 40-ton semi-truck barreling down the highway, or a bus packed with people. The potential impact, it's huge.
It really is. And that's the why behind all this regulation. It's not about making life difficult. It's about the sheer scale of risk. If a CDL driver isn't absolutely 100% sharp, focused, clear-headed, the consequences are, well, they're potentially devastating.
Yeah.
We're talking multiple lives, massive economic disruption. One bad moment can change everything. And what we're seeing in 2025 is the Department of Transportation really doubling down, emphasizing that public safety link for every single commercial vehicle mile.
Exactly.
Yeah.
It's not negotiable. The government is making it crystal clear. These are hard requirements, not suggestions. It's about ensuring that person behind the wheel is always at their best.
Yeah.
Okay, so who exactly are we talking about here? When we say DOT testing, it doesn't mean every single driver on the road, right?
No, definitely not. It's specific.
So who needs to have these rules, these very strict rules, on their radar? Well, the sources are pretty clear. You fall under these DOT drug and alcohol testing rules if you're operating a vehicle that weighs 26,001 pounds or more.
That's a lot of trucks.
A lot of trucks, yeah. Or if you're driving a vehicle that's designed to carry 16 or more people. And that includes the driver.
So think big passenger vans, buses.
Exactly. And the third category is transporting hazardous materials. Things like gasoline, certain chemicals, anything placard requires it.
And the key thing here is if you fit into any of those boxes, even just one, then compliance is absolutely mandatory. There's no wiggle room. And importantly, saying, oh, I didn't know, that just doesn't fly with the DOT.
Right. Ignorance isn't an excuse.
Not at all. It's fundamental to the job. The system is designed to catch a wide range of safety-sensitive roles, not just the obvious long-haul truckers.
Okay, so we know who gets tested. Now, what are they actually looking for in these DOT drug tests? What substances?
There's a standard panel they use.
Yeah, our sources point to 5 main categories, the big 5, sometimes called. First up is marijuana, THC. And this one trips people up, like you said, even if it's legal where you live. For CDL drivers, it's banned under federal law.
Yeah.
Full stop. The DOT follows federal rules.
Absolutely critical point.
Then cocaine, obviously.
Yep.
Also opioids. That includes things like heroin, but also prescription painkillers like oxycodone, hydrocodone.
Right, the ones you hear about.
And amphetamines and methamphetamines. This is another tricky one because some ADHD medications fall into this category.
That's a really important flag for drivers.
Definitely. And the fifth one is PCP, phencyclidine.
So those 5 are the standard DOT panel.
Which brings us to something you mentioned, prescriptions. This is huge.
It really is. Look, if you are taking any prescribed medication that might show up on that test, even if it's perfectly legal and necessary for you, you absolutely must have a specific note from your doctor. And it can't just say you're taking it.
Right. What does it need to say?
It has to state clearly that the doctor has evaluated you and determined it is safe for you to operate a commercial motor vehicle while on that medication.
Wow, that's specific.
Yes. Without that exact clearance, even a legit prescription could trigger a failed test result. It shows how focused the DOT is on the effect of a substance, not just its legality. Your ability to drive safely is paramount.
Okay, this is where it gets really interesting for drivers day to day. It's not just a one-and-done test when you get hired.
No, far from it.
The DOT mandates testing in 5 key situations. You basically need to be ready for a test throughout your career.
That's right. Constant vigilance.
So the first one is pretty straightforward, pre-employment. You have to pass before a company can hire you for a driving job. It's like the entry ticket.
Standard practice. Makes sense.
Then there's random testing. And this is the one that keeps drivers on their toes.
Completely unpredictable.
Exactly. You can be selected anytime, anywhere, no warning. The whole point is that unpredictability to ensure people are always compliant.
It definitely encourages staying clean.
For sure.
Third is post-accident testing. If you're in a serious crash, there are specific DOT criteria, like a fatality, or if a vehicle needs towing and you get a citation. You're almost certainly getting tested for both drugs and alcohol afterwards.
Standard procedure in serious incidents.
Fourth, reasonable suspicion. If a trained supervisor sees specific signs, slurred speech, smell of alcohol, erratic behavior, things they can actually articulate.
Needs to be observable, documented.
Right. They can require you to take a test immediately.
That's a critical tool for immediate safety intervention.
And finally, return to duty testing. If you failed a test in the past, you can't just jump back in the truck. You have to go through a whole process, and part of that is passing a specific test before you're allowed back in a safety-sensitive role.
And that process often involves follow-up testing, too, for quite some time.
Yeah. So those 5 scenarios really cover the life cycle of a driver's career.
They do. And that random testing piece especially, it really changes the game, doesn't it? It means sobriety isn't just an at-work thing. It has to be an always thing for a CDL driver.
Good point. It really embeds that responsibility deep into your daily life. Now, we've talked a lot about drugs, but the rules around alcohol, they're actually even tighter for CDL drivers.
Yeah, significantly tighter than for, say, you driving your personal car.
Let's break those down.
Yeah.
For most drivers, the legal limit, the BAC, blood alcohol concentration, is 0.08%.
Right. That's the common number people know.
But for a CDL driver operating a commercial vehicle, it's got to be under 0.04%.
Half the limit.
Exactly, half, which is incredibly low. And then there's the 4-hour rule.
Ah, yes, the bottle to throttle rule, some call it.
Right, you cannot drink any alcohol within 4 hours of starting your shift driving a commercial vehicle.
4 hours, no exceptions.
And, just like drugs, random alcohol testing is also a thing. They can check your breath anytime.
That 0.04 versus 0.08 really highlights the difference in expectation, doesn't it? It sends a clear message. For CDL drivers, even a tiny bit of impairment is too much risk.
It absolutely does.
The unofficial advice is always 0 is safest. Don't even get close to that 0.04. And another huge point here. Refusing an alcohol test.
What happens then?
It's treated exactly the same as failing it. Same consequences. You could lose your CDL for at least a year, maybe more.
Wow. So cooperation is mandatory.
Absolutely. There's no upside to refusing. The government's stance on alcohol is extremely firm for commercial operators.
Okay, so we've covered who, what, when, the specific alcohol rules.
Yeah.
Let's talk consequences. What actually happens if you fail a DOT drug or alcohol test? It sounds serious.
It is very serious. The impact is immediate and significant.
So first thing.
You're immediately removed from any safety-sensitive functions. Basically, you cannot drive a commercial vehicle, period.
Keys are pulled.
Essentially. Yep, right away. And then your job is almost certainly in jeopardy.
Most companies have zero tolerance.
Many, if not most, do. The liability, the insurance issues, the safety risk, it's often grounds for immediate termination. It's a massive blow to your career.
And getting back behind the wheel, if you even can, it's not easy, is it?
Not at all. There's a whole formal process called the return to duty process. It's rigorous.
What does that involve?
First, you have to be evaluated by a substance abuse professional, or SAP. They're DOT qualified specialists.
Okay.
They'll assess you and prescribe education or treatment. Could be classes, could be counseling, could be more intensive rehab, depending on the situation.
And you have to complete that?
You have to successfully complete whatever the SAP requires. Then you have to pass a return to duty drug and/or alcohol test.
And that's it. You're back.
Not quite. Even after you pass that test and are technically cleared to return, the SAP will set up a schedule of follow-up testing.
Ah, so ongoing checks.
Yes, typically at least 6 tests in the first year, but it can go on for up to 5 years. Unannounced tests.
Wow, that's a long time.
It shows the commitment to ensuring long-term sobriety. And throughout this, your CDL could well be suspended, often for a year or longer, depending on the circumstances and state regulations. It's a tough road back.
It really underlines the government's position. Rehabilitation is possible, but safety isn't compromised during that process. So, given these high stakes, let's talk practical advice. How can drivers stay compliant, stay safe, and avoid these serious problems? What's the takeaway?
Well, some of it sounds obvious, but it bears repeating because the rules are so strict.
Number 1.
Avoid illegal drugs. Period. And remember that crucial point about marijuana federal law for CDL drivers overrides any state law. It's just off limits.
Okay. Simple enough. What else?
Check your medications. Seriously, talk to your doctor and your pharmacist about anything you take, even over-the-counter stuff like cold medicine.
Because some ingredients can trigger a positive.
Exactly. Ask specifically, could this cause a problem on a DOT drug test? Get that doctor's note we talked about if there's any doubt or if it's a controlled substance prescription.
Good advice. What about alcohol?
Just skip it before work or anywhere near work time. That 4-hour rule, that .04 limit, it's safest to just have a clear separation between drinking and driving a commercial vehicle. 0 is best.
Makes sense. Any other tips?
Know the rules around testing. If you get selected, cooperate. Understand the process. You have the right to ask questions, but follow the procedures. Don't refuse a test.
Right. That leads to automatic failure.
Exactly.
So the core message really seems to be about professionalism and responsibility.
Absolutely. That CDL isn't just a piece of plastic. It signifies trust. It signifies you're capable of handling immense responsibilities safely. By staying clean, following these rules meticulously, you're not just protecting your livelihood, your job.
You're protecting everyone.
You're protecting everyone on the road, every family out there. It's a huge part of being a professional driver.
That really puts it in perspective. This whole deep dive underscores how vital these DOT rules are, especially now in 2025 with this intense focus. It's not just bureaucracy.
Not at all.
It's about recognizing the unique potential impact of these large vehicles and ensuring the highest standards of safety. It truly is about protecting lives.
Definitely. So, quick recap of the key takeaways.
Go for it.
Drug tests, they can happen anytime. Always be ready. Alcohol, 0.04% is the limit, but 0 is the goal.
Right.
Prescriptions need that specific doctor's note confirming it's safe to drive commercially. And failing a test, huge career consequences, just not worth the risk.
Drive smart, drive sober.
That's the essence of it. Keep delivering safely.
So here's a final thought to leave you with, something maybe to mull over. With the government maintaining such incredibly strict testing and safety standards for human commercial drivers in 2025, how might this intense regulatory focus shape the conversation around, and maybe even the adoption of, autonomous or self-driving commercial trucks in the future? What new safety debates might that open up?
That's a fascinating angle. The human element versus the tech element under scrutiny.
Definitely something to think about. If you want to dig even deeper into the official rules, talk to your company's safety manager. This should be a great resource. Or check out the official Federal Motor Carrier Safety Administration website. That's www.fmcsa.dot.gov.
Lots of detailed info there.
Absolutely. Well, that wraps up our deep dive for today. Stay safe out there. Stay informed.
Thanks for tuning in.